Check. It's a little less now and little more.
Louder பேசுனா
Huh?
லவுடா பேசுனா தான் கேக்குது. நார்மலா பேசுனா அந்த மாதிரி கேட்கல கேட்குது.
இங்க வந்து can be mute பண்ணிக்கலாம். I think we should settle down. Shall we all settle down?
If you wanted to choose he's checking that.
On the Zoho, the chat window, you start in a few minutes.
That's what I say. Because
Good afternoon, everyone. I hope you are all doing well. A very warm welcome to all the attendees present here and in person and those joining us virtually. We are delighted to have you for today's Physiology Alumni Lecture Series, PALS, which is a part of the Silver Jubilee celebrations of the MD Physiology program at Sri Ramachandra Medical College and Research Institute, Chennai. The program commenced in 2005 with just 3 postgraduates, and over the years, it has grown exponentially. We are proud to have had 58 MD Physiology graduates who have excelled in their field, emerging with flying colors. Currently, we have 8 dedicated MD postgraduates enrolled in this program, continuing the legacy of excellence. This monthly hybrid lecture initiative is designed to bring together our esteemed alumni, students, and faculty to share knowledge, to inspire academic growth, and to create a community of physiologists. It's designed to benefit the current postgraduates and the physiology enthusiasts of our institution and nationwide. This program shall serve as a bridge between the past and present, fostering inspiration, collaboration, and academic excellence between the alumni of the Department of Physiology. By creating opportunities for the alumni to contribute to the academic growth of the alma mater, PALS embodies the spirit of lifelong learning and professional development. Join us in celebrating this milestone and enriching the future of physiology education. We are privileged to have with us today Dr. Manikandan Sir, Associate Dean, Students, Associate Professor in the Department of Biochemistry, Dr. Padmavati Ma'am, Senior Professor in the Department of Physiology and Additional Controller of Examinations, Dr. Priscilla Johnson Ma'am, Associate Dean, Medical College, and Senior Professor in the Department of Physiology. It's a privilege to welcome Dr. Vasanthi. Before we begin with the speaker introduction, I would like to call upon Dr. Meenakshi Ma'am to give an account of another program which we had conducted in February.
Check, mic check, check. No, it's not. No, it's on. Check, check.
No, he said the first one from left. Yes.
Check, check, check the last row.
Yes.
Yes, good afternoon to one and all present here. As you all are aware, the Department of Physiology conducted an online digital art competition in lieu of International Day of Women and Girls in Science on Feb 11, 2025, themed Women in Science, the Way Forward. All the students of Srihar University were invited to participate in the competition, among which we received 20 entries, 8 entries from your batch, MBBS Phase 1 24-25 batch, 1 entry from 23-24 MBBS batch, 3 entries from BDS, 2 from BPT, 1 from BOT, 1 from MDS, BSc Nursing, BPharm, Allied Health Science, BTech Cyber Security, and various other courses. So after blinding the artwork sent by you, it was sent to the judges, Dr. Srinivasa Rajappa sir, Professor and Head, Hand Surgery, and Dr. Nalini ma'am, Principal of Nursing, Srihar. The average scores were calculated based on the scoring sheet sent by the judges, and top 3 prizes were selected. All the 20 entries were displayed on the notice board. I now request our Associate Dean, Dr. Manikandan sir, to give away the prizes.
Switch on the mic. Unmute the video.
எல்லாம் பண்ணியாச்சு.
Check the mic.
Check. Hello. Hello, check. Hello, check. Hello, check. Hello, check.
ஆடியோ வீடியோ டீம்
Check பண்ணிட்டு
இல்லை இந்த லைட்டில்
Ma'am, order. Proceed.
please understand the difficulty that's happening here.
பண்ணுங்க சார்.
On that, sir. Am I audible now?
Yes.
A peaceful good afternoon, ma'am, and the audience. It's an immense pleasure for me to have our alumni here at our institute today. So to begin with, Dr. C. Vasanthi ma'am, who is currently an assistant professor of the Department of Physiology at Panimala Medical College, Hospital and Research Institute, Chennai. In her medical career, she had finished her MBBS degree at Stanley Medical College in 2007 and her MD Physiology from a very own university in the year 2013. In the course of her career, she had spent 7.5 years as an exercise physiologist and currently in the stage of an academic capacity as a medical physiologist for the close to around 4 years. Additionally, in her endeavors of sports education, she is a qualified ISA Kit certified level 1 kinanthropometrist and MCI recognized Swayam portal online course of basic in biomedical research and an international course on bioethics by UNESCO chaired bioethics. And also, she had completed a course in communication skills for healthcare professionals. In her areas of expertise, she is well versed in the field of exercise physiology and sports medicine. Her publication is a list of 7, along with an additional research gate project with Dr. Padmavati ma'am and along with Dr. Tyagarajan sir from the Center of Sports Science in her very own institute. Along which she is a member of the Board of Studies member in Tamil Nadu Physical Education and Sports University. She is also a life member of the APT and a member secretary, a unit of yoga in Panimala Medical College, Hospital and Research Institute. Thank you for being here with us today, ma'am. Now, I request Dr. Vasanthi ma'am to take over the dais. Thank you.
The other presentation.
இந்த வீடியோ வரும்போது
இல்லை இது எது அடுத்த
இது அதான் இப்போ ஓபன் பண்ணேன்.
இந்த ஹேண்ட் மைக் கொடுங்க. மைக் எங்கே வச்சிருக்கு? ஹேண்ட் மைக்
அதை க்ளோஸ் பண்ணுறேன்.
இல்லை இது வரும்
ஓ சாரி.
இந்த டூப்ளிகேட் ஸ்லைட்ஸ்
Hello. 2.
Now we like this.
2.
Okay.
What is the direct change? Center is the laser point.
Okay. Good afternoon to one and all assembled here. At the outset, I would like to thank Dr. Muthu Pratibha ma'am for head of the Department of Physiology, Sri Ramchandra Medical College, for giving me this wonderful opportunity. I'm very happy, very excited to be a part of Physiology Alumni Lecture Series, which commemorates the Silver Jubilee celebration of MD Physiology program in our esteemed institution. I'm very much happy to be a part of this program. My wishes, my warm regards to my teachers who are here, and my wishes to the faculty and the postgraduates who have joined online and offline across the state, and also my wishes to undergraduate students who have joined here for this session. Most of us are working out every day, yes or no? In the form of any physical activity or a regular workout, we are doing it. So we don't know the science behind the workout. Okay, so this session is for that. So how our cardiovascular system enhances the performance. So that is what we are going to look at today. So the topic suggested to me was cardiovascular dynamics during exercise. Hope I will do justice to this topic. Yes. So whenever we work out, we all know that there are a lot of physiology behind it. There are a lot of systems operating it. So why we do exercise? By doing exercise, we are trying to challenge our human body. And as a response to this challenge, the human body does a lot of adaptations in its physiological system, so that next time if you do the exercise, it will be a better performance. So that is the motto behind the adaptations we see in the various systems of our body. So whenever we initiate any muscular movement, muscular movement, there is a lot of involvement from the central nervous system and also the cardiovascular system and the respiratory system. So does the job of making us to continue the exercise. Okay. So through all these changes, we just know that our body is moving, but actually there are a lot of systems that are operating behind these mechanisms. So that is what we are going to look at today. So the objectives we are going to cover in this session, we are going to discuss the grades of exercise, and we are going to discuss the cardiovascular changes due to acute exercise and due to static exercise. And in the later part of the session, we are going to deal with the training adaptations. So let me begin with the definition of exercise and physical activity. Most of us confuse between these two. So whenever we do something structured and repetitively, that becomes an exercise. So the exercise are targeted upon improving or maintaining the physical activity, physical fitness of an individual. Physical activity, what do we mean by physical activity? So any body movement we do using our skeletal muscle, which is above the resting energy expenditure, so that we call it as a physical activity. So some of you would have walked up the stairs to this hall, or as a part of our daily living, we do a lot of activities that also comes under physical activity. But if you do it in a structured manner, that becomes an exercise. So when you look at this slide, what do you understand from this slide? So we are looking at two important aspects of physical fitness: the sports-specific physical fitness and health-related physical fitness. So why we should learn or why we should know about exercise physiology? Because it is not only useful in improving the sports-specific performance, and also it is helpful in the optimizing our health. Okay. So when you look at the spectrum, so there are various parameters which are mentioned here. So we look at the cardiovascular endurance. We have
aerobic capacity, we have muscular strength, and we have endurance, we have balance, flexibility. And we can understand that the cardiovascular endurance plays a very major role, not only in improving the sports performance, but also in improving the overall health. So looking at the types of exercise, most of us will be familiar with. So there are two basic types of exercise, isometric and isotonic. So what is isometric exercise? It is where there is no change in the length of the muscle fiber. The tension in the skeletal muscle fiber alone increases. So just to look at the examples for isometric exercise, when you do wall push-ups or when you do a plank, okay, so we try to maintain one position, okay, so that comes under isometric exercise, where there is enormous increase in the tension of the muscle, but the length of the muscle remains the same. But when you look at the isotonic exercise, there is a change in the length of the muscle, okay, the tension remains the same. So if you take out, if you consider running, jogging, swimming, all this comes under isotonic exercise. And we have another classification of exercise based on the energy system we utilize during exercise. So there are three predominant energy systems we utilize during any muscular activity, namely your ATP phosphagen system, you have anaerobic glycolysis, we have aerobic system. If you predominantly rely on aerobic system, that becomes an aerobic exercise. Most of the aerobic exercise will be a moderate to long duration activity, and which takes a moderate effort from your side, okay. But when you take an anaerobic exercise, it relies on the ATP phosphagen system and the anaerobic glycolysis. Without the predominant usage of oxygen, we are trying to work out, okay. So the anaerobic activities may be sprinting, we can consider as an anaerobic activity, where there is a quick burst of energy, okay. We need an all-out effort here, so that comes under anaerobic activity. So whatever we are going to discuss now, it is predominantly to be considered with the aerobic exercise. Whatever changes I'm going to show you from now on, it is predominantly with the aerobic exercise. Wherever I wanted to emphasis on anaerobic activity, I will do that. So let us look into the grading of exercise. So the grading of exercise is based on various variables. You can see there are various grading here. You can take any one of the variable for grading of exercise. It can be VO2 max, it can be the heart rate max, or it can be a heart rate reserve, or it could be perceived exertion. Based on that, we can categorize the exercise into light, moderate, severe, or it can be near maximal to maximal activity. So based on the VO2 max, we can classify. So these are the numbers. So VO2 max is your maximal oxygen consumption, which I will be explaining in the further slides. And based on the heart rate max also, we can classify the exercise, and heart rate reserve, how much more we have still. So based on that also we can classify, and based on perceived exertion, how we perceive exercise. So for you, it may be a light exercise. For me, it may be a severe form of exercise. It is a subjective feeling. So there is a scale for assessing perceived exertion. We call it as box scale. So the rating is from 6 to 20. So somebody is working out in the gym, you just show this chart, okay. So it comes from 6 to 20. So you ask him, how do you feel now? Okay, he says that I'm feeling that I'm mildly exerted. Maybe the score is around 6 or 7 or 8. Okay, when he says that I'm maximally exerted, I cannot strain much more, okay, I cannot proceed much more, that becomes a maximal activity. So the score is around 20. So based on the score also we can classify exercise. And if at all you want to find out the intensity of exercise, you can do a very simple test to assess whether you are doing a right intensity of exercise. You can just simply employ talk test. Have you ever heard about talk test? So just ask the individual to repeat a statement which you are saying them. So if the individual is comfortably able to repeat it, that comes under mild activity. Okay, so if he is able to repeat the statement, but there is here and there he is stopping. Okay, there is some breakups in between the statement, in between the words, then you call it as a moderate intensity. Suppose he is not able to utter even a single word, that comes under a severe activity. Okay, so based on this also we can classify exercise. So looking at the most important or most crucial variable revolving around exercise physiology is your VO2 max. We call it as maximal oxygen consumption. So what is this VO2 max? It is the highest rate of oxygen consumption attainable during a maximal exercise. So that is the limit for our oxygen consumption. We all know that the resting oxygen consumption is around 250 ml per minute. All of us, we know that. So it can go to an extent of 3 to 4 liters per minute. Okay, even beyond that in elite athletes. So VO2 max is the variable which indicates how much more oxygen, or what is the limit of oxygen uptake by your body. So why we are worried about this oxygen uptake? So oxygen is going to be the fuel which is used in the oxygen is used to burn the substrates which we use in the aerobic metabolism. Okay, we very much require oxygen for the continuation of aerobic metabolism. So there is a limit for aerobic endurance or the aerobic activity. So that is based on the VO2 max. It is an indicator of cardiovascular fitness. So if you assess an individual for VO2 max and you see that the numbers are good, so you can definitely say that his cardiovascular system functioning is on a optimal level. Okay, and it is also used to grade the intensity of exercise. As I showed in the previous table, if you want to grade the intensity of workout, you can use this VO2 max. And also, if you want to check whether the training which has been offered to the individual is effective or not, you can see the change in the VO2 max. Okay, there will be an improvement in the VO2 max. So that is what is this variable about. And VO2 max has so many applications in exercise physiology. So there are a lot of research studies being conducted targeting how to improve VO2 max, and also what are the factors which are deciding or which are limiting the performance of an individual. So as you see in this equation, so VO2 max is decided by stroke volume, heart rate, and arteriovenous oxygen difference. So these are the variables which decides the oxygen consumption. So stroke volume and heart rate put together is your cardiac output. So basically, that is the cardiac output and the arteriovenous oxygen difference decides the VO2 max of a person. So we can say that the cardiac output is the central factor which can decide the VO2 max, and arteriovenous oxygen difference is the peripheral factor which decides the VO2 max. What is this arteriovenous oxygen difference? So that is the capacity of the muscle to extract the oxygen. Okay, it is being offered some amount of oxygen. How good it is to extract the oxygen from the blood vessel. So that is what is the arteriovenous oxygen difference. So let us discuss about this in the later slide. So we all know that when we are working out, there are various physiological systems getting worked out. So if you could see, just the thought process of exercise, okay, so the initiation of the thought process of exercise starts in the central nervous system. So it starts in the frontal lobe, and the impulses are sent to your motor cortex, and from there, okay, various cardiovascular and the respiratory centers are coordinated. So even though the muscles are doing the job, all the systems have to integrate. Okay, then only the output will be optimal. So that is what we are going to target today. So as I told you, there are limiting factors for VO2 max, how much more we can take oxygen for exercise. It could be based on your diffusion capacity. How good is your lung? Okay, how good is your diffusion capacity? So based on that, the oxygen transport can be affected. The oxygen availability to the muscles can be affected. Number two, it can be the oxygen carrying capacity in the form of hemoglobin. So how much we have, okay? So whether we have a proper oxygen carrying capacity, that can also alter our performance. And thirdly, you have your cardiac output. How good is the blood flow to the skeletal muscle? That will also decide your VO2 max. And lastly, how smart is your skeletal muscle? How capable it is to extract the oxygen and utilize it for the performance. So these are the 4 factors which can limit your VO2 max. So of all these 3 factors, so it has been identified that in well-trained athletes, so it is more of the cardiac output which is the limiting factor rather than the other 3 factors, because the lung performs to the maximum. And if you witness in the further slides, you can understand that there is a lot of limiting factor in the cardiovascular function. So the cardiovascular system is the one which limits the performance in most of the well-trained athletes. So now moving on to the topic as such. So what are the changes which are happening in the cardiovascular system when we do exercise? So basically, the aim of the cardiovascular changes are these 3. So first, it has to increase the cardiac output so that more blood reaches the muscle. And of course, it has to increase the muscle blood flow. And lastly, it has to divert the blood flow from the organs which are not active during exercise. So for example, if you take the kidney, the liver, or the splanchnic circulation, there is no necessity for the blood supply, or there is not of much need for a blood supply during exercise. They are not going to be active during exercise. So that is the reason the blood is diverted from those regions to the working musculature. So moving on to the first variable we are targeting. So that's the heart rate. So it is one of the simplest physiological variable which we can measure, and we can check the response to exercise. So we can use heart rate monitors. Pretty much now there are a lot of physical activity monitors are available, which we can use it as a wearable form of physical activity monitors. We can monitor the heart rate during our activity. And it is a very good indicator of relative exercise intensity. So as you see in this picture, that's a heart rate monitor, so which the person is wearing. And you can monitor the heart rate using that, using a wearable watch. So it's a very good indicator of relative exercise intensity. And what are the changes in heart rate when the person is exercising? So as you see in this graph, okay, whenever there is an increase in the intensity of exercise, the heart rate is going to increase proportionately. Suppose if you do a mild exercise, you can expect a mild increase in the heart rate, okay, maybe above 25, around 25% of your resting heart rate, there will be an increase. If you do a moderate exercise, accordingly, there will be a change in the heart rate. But is there any limit for the heart rate? Yes. So there is a limit for the maximal heart rate. So you can see, even though if you increase your workout, you keep on increasing your workout or workload. So what happens? There is no much change in the heart rate. So that is the maximum we can go up to. So that is called as the maximal heart rate. Okay. So maximal heart rate, as you see in this graph, the heart rate is increasing progressively as the intensity of exercise increases. So this axis is showing the intensity of exercise in terms of VO2 max. So 25% of VO2 max is a mild activity, and 50% is considered to be a moderate. More than 75% it is going to be a maximal activity. So based on that, you can see that the heart rate is increasing proportionately, and there is a point where the heart rate has no point to increase. Okay, that is going to be stationary. So that point is your maximal heart rate. So can we predict our maximal heart rate without doing a workout or without doing any test? Can we predict our maximal heart rate? Yes, we can do that. So there are formulas available for that. It is based on your age. Okay, so based on the various research studies conducted on a population basis. So these formulas have been derived. So one of the very prominent formula which we use in exercise physiology for calculating age predicted maximum heart rate is Carbonan formula, as you see here. So this is 220 minus age in years. Suppose the age of an individual is around 70 years. What is the maximum heart rate? Can you guess? What is the maximum heart rate the person can go up to? 220 minus 70. How much it is? 150. Okay, so he can do exercise, or he can do a cardiovascular testing up to the level of 150. So that is the limit for his heart rate. Okay. So there is one more formula available, which is 208 minus 0.7 into age in years. So this is considered to be much more accurate than the previous one. And also it is noted that there is an age-related decline in the maximum heart rate as we grow older and older. So there is a reduction in the maximum heart rate, which we can go up to. So moving on to the steady state heart rate. What is the steady state heart rate? So whenever we do a particular intensity, the heart rate increases. If you continue to do in the same intensity, the heart rate will remain the same. I'll show this graph. So you can see timely there is an increase in the workload. You can see every 3 minutes there is an increase in the workload. So every workload, the heart rate is also increasing. And after a point, it becomes plateau. You can observe that. Yes. So this is called a steady state heart rate. Okay. So imagine you are running on a treadmill. Okay. So you are running at 6 kilometers per hour. So initially, the body will struggle to find out what is the oxygen demand which is required, and it will try to adjust it. It will increase the heart rate. The heart rate, now the body knows what is the optimum heart rate for this workout. Okay, so it becomes a steady state. So that is called as a steady state heart rate. So very much many of us are aware of various protocols available for cardiovascular testing, like your Bruce protocol or Balke protocol. So all this involves progressive increase in the workload. What we do is we make the individual to run on the treadmill. Every 3 minutes, there will be a change in the speed or in the incline of the treadmill. So there you can definitely see there is a increase in the heart rate, and after a point, it becomes a steady one. So why we are knowing this? Why we should know about the steady state heart rate? So a lot of tests are available to assess the cardiovascular endurance of an individual. So we can do simple walk tests, you can do step tests, you can do submaximal tests are available. All these tests are based on the steady state heart rate. Okay, what is this steady state heart rate? So a person who has better fitness will have a lower steady state heart rate. Okay, for a particular workload, if one person is fit, his heart rate response will be low, and whereas a person who is not fit, the heart rate response will be but much higher than that. So based on this, we can guess so that his fitness is not optimal. His fitness has to be improved based on his heart rate response. I will show this curve. You can tell me which person is fit here. So you have two persons working out here on a bicycle. Maybe you can call it as a submaximal exercise, maybe YMCA submaximal test. So he has been made to do exercise with 50 watts, 150 watts, 200 watts and 250 watts. So you can see a person A who has achieved a higher workload of 250 and a person B who has achieved a workload of 200. Can you tell me who is fit here? Any guesswork? Who's fit here? Yes. Who's fit? A or B? No answers? A. Yes. So you agree with me, it is A? Yes, it is A, because you can see for every workload, if you take 50 watts or 100 watts, there is a lower heart rate increase for A, and whereas B is showing a much more higher heart rate. So that means what? The fitness of the cardiovascular fitness of A is much more better than the person B. Okay. So, and also you can see that he has gone for a higher workload. So he can go up to 250 watts. So that is why the steady state heart rate are very important in order to understand the cardiovascular testing. Okay, so now let's move on to the mechanisms behind increase in the heart rate. Why the heart rate is increasing? First of all, it is the central command from the higher centers. When we just think about exercise, okay, so many of you will just at the end of the day, you just have a thought. So whether we have to hit the gym today, yes. So as soon as your thought process starts, I want to hit the gym today, your heart rate seems to increase. So that is called as an anticipatory increase in the heart rate. So why it is happening? So the impulses from the frontal lobe, so which is sent to the motor cortex for initiation or processing of the activity, and simultaneously it is also sent to your cardiovascular center and the respiratory center in the medulla. So it is called as co-activation. Okay. So this central command is responsible for the initial increase in the heart rate as soon as you start to do exercise. Okay. So that's called as the central command. And of course, we know that it is due to the increase in the sympathetic discharge, and also peripheral reflexes are operating from the exercising muscle and the joints. So there is continuous feedback from the muscle. Okay, so the muscle is informing the brain that this person is working out. Somehow you have to increase your heart rate and supply me with the blood. So that is the reason the heart rate is increasing. Local metabolic factors which are accumulated in the muscle, and maybe one of the reason is vein bridge reflex. So to recollect what is vein bridge reflex, so whenever a person does exercise, there is a increase in the venous return coming back to the heart. Okay, so your skeletal muscle pump is working, more blood is flowing into your heart. So there is more stretching of your atrium. So that will stimulate or increase the heart rate. So that is called as vein bridge reflex. This is also considered to be the reason for increase in heart rate. Okay, having spoken about the heart rate, let's move on to the stroke volume. Stroke volume, of course, we know the amount of blood pumped out by each ventricle per beat. So it is influenced by three primary factors. Okay, we have three primary factors here. One is your preload and contractility, or your myocardial contractility, and afterload. Yes, so the preload is nothing but your the degree to which the myocardium is stretched. Okay, so how the myocardium is stretched? It is stretched because of the flow of the blood. More the inflow of the blood, it is going to get stretched. Okay, so the end diastolic volume, if it increases, it is going to increase the preload. How can you increase the end diastolic volume? When you have more venous return coming back to your heart, so the end diastolic volume is going to increase. Of course, it is going to increase your stroke volume as well. And contractility. Okay, so there are factors which increase the myocardial contractility. The foremost one is your sympathetic activation. So the sympathetic system can increase the myocardial contractility. And the next in line is your afterload. Okay, so the resistance against which your heart is pumping. Okay, so the resistance is nothing but your peripheral resistance, or the pressure prevailing in the vessel, so against which the heart is going to pump. Okay, when the heart afterload is increasing, the stroke volume is going to reduce. So now let us see what happens to the stroke volume during exercise. The stroke volume is also going to show a proportionate increase as the intensity increases. But the only point I want to stress here is you cannot expect the stroke volume to increase till the maximum. Okay, so you can see a plateau. In almost 40 to 50% of your intensity itself, there is the plateauing of the stroke volume. So this in the heart rate, you saw a graph, no? So it was continuing till the maximum. But here in the stroke volume, you can see halfway through it has become a plateau. Why it has become a plateau? So just relate the previous graph with this graph. Okay, so when the heart rate is increasing, when the heart is working at the maximal rate, what will happen? Which is compromised there? The duration of cardiac cycle is compromised. The duration of diastole is compromised. What will happen? The ventricular filling will be reduced. So when the ventricular filling is reduced, the preload is reduced. So therefore, the stroke volume will also be reduced. So it is not reduced, actually, it is not improved. Okay, so that is why you can see a plateau in the stroke volume. Yes. So why there is a change in the stroke volume? As I mentioned, there is an increase in the preload. So there are two pumps which are helping us in the improvement of the preload. One is your skeletal muscle pump, which is present in your lower limb. So your soleus pump is working whenever you are doing some lower limb workout. So these muscles are contracting, right? So when the muscles are contracting, it is going to improve the movement of the blood up towards the heart in the deep veins. So that way it is going to increase the venous return. And one more, we have the respiratory pump. So whenever we do exercise, what is happening? There is an increase in the breathing rate as well. So when you inspire, so there is an increase in the negative pressure present inside the intrathoracic region. So therefore, the entry of blood towards the atrium will be good. So the venous return increases because of these pumps. And the myocardial contractility is also increasing. Why there is myocardial contractility which is increased? It is through the mechanism, Frank-Stahl's mechanism. Okay, what is Frank-Stahl law? We know that. So whenever there is more venous return, there is increased stretching of the ventricular muscle fiber. So therefore, it is resulting in an increased contraction. So that's what is about Frank-Stahl mechanism. And also, when we do exercise, there is a decrease in the peripheral resistance or the afterload because of extensive vasodilation happening in the skeletal muscle. So the peripheral resistance is low. Therefore, your stroke volume is going to increase. So all three factors put together is going to increase your stroke volume. So what are the factors? So it is going to be increase in the preload because of increase in venous return, increase in myocardial contractility because of sympathetic stimulation as well as the Frank-Stahl mechanism, and decrease in the afterload because there is decrease in the peripheral resistance. So what happens when? Okay, so this Frank-Stahl mechanism has a great influence at lower exercise intensity. Okay, so till your 50% of your maximal intensity, so there will be a usage of this Frank-Stahl mechanism. But beyond that, it is only through the improved myocardial contractility there is an increase in the stroke volume. Why at higher intensities the Frank-Stahl mechanism is not operating? Because, of course, no, there is no enough time for the filling. So the Frank-Stahl mechanism is not going to be optimal during that time. So therefore, it is only through the sympathetic stimulation improvement in the myocardial contractility happens. So two factors we have completed. Moving on to the cardiac output. So of course, cardiac output is a function of stroke volume and the heart rate. When both are increasing, the cardiac output is going to increase. Okay, so you can see here the cardiac output also proportionately increases in order to meet the demands of the exercising muscle. So you can expect an increase up to 20 to 30 liters, even up to 40 liters it is possible in a very elite athletes. Okay, it is a function of body size and also endurance training. So as you witness in this graph, there is an increase in the cardiac output and it also has a maximal limit. So we call it as maximal cardiac output. And one more phenomena which operates here, which is very helpful in distributing the blood to the skeletal muscle. So that is the cardiac output redistribution. So most of us are aware about the cardiac output distribution at normal times, that is at rest. So which is the organ which gets the maximum blood supply? Which is the organ which gets the maximum blood supply? Can I get some answers? It is shown here. Come on. Which gets the maximum blood supply? Liver. Yes, followed by kidneys. Yes. Okay. So the muscle blood flow is very negligible, or you can say it is minimal compared to the other organs. Okay, so close to 800 to 1000 ml is the skeletal muscle blood flow. Just look at the exercise. Okay, the only organ which is grabbing all the cardiac output is your skeletal muscle. Close to 80% of the cardiac output is diverted to your skeletal muscle. So how this is possible? So we have to compromise some organs, right? So who are compromised here? Your liver, your GIT, your kidneys are compromised, and we are sending the blood flow to the active musculature. Even the muscles which we are not working out, no, those muscles are also compromised. Only the working musculature, so that receives the blood flow. Okay, so there is diversion of blood flow, as I told you. So there is extensive vasoconstriction happening in the regions which are inactive, okay, which are not working out. So those, there will be a vasoconstriction. But whereas the working muscle will, there will be a vasodilatation. Why there is vasodilatation? There is production of metabolite inside the muscle. So like your carbon dioxide, your hydrogen ions, all this will cause vasodilatation, and it is going to offset the sympathetic stimulation. Sympathetic stimulation is going to cause vasoconstriction, right? So, but here, because of the local metabolites, so there is going to be vasodilatation in the skeletal muscle. Also, there is one more set of fibers called as sympathetic cholinergic fibers, which can cause vasodilatation in the skeletal muscle. So we can appreciate from this picture that there is an increase, extensive increase in the skeletal muscle blood flow. So at rest, it is usually 2 to 4 ml per 100 gram per minute, but it has increased to 90 to 100 ml per 100 gram per minute. Okay. So now we have seen about heart rate, we have discussed about the stroke volume and the cardiac output. So now let me introduce a new concept to you. So that is about cardiovascular drift. Okay. So can you guess what are these activities? Of course, from this picture, you will identify. What is this? Can you identify? Marathon running. What is this? Football. Okay. So what is this? Any guesswork? Cycling, of course, it's a very long distance event happening over weeks together. Okay, it's called as Tour de France, which happens over weeks period of time, covering so many kilometers. So why I showed this picture? Because so all these activities are a prolonged duration activity. Okay, so what happens to these cardiovascular variables when you do a long duration activity? When you work out for hours together, what happens to these variables we are going to look at. So that mechanism or that phenomena is called as the cardiovascular drift. Okay, so there is a change. There is the change in the trend of the variables. There is going to be a tough competition between two organs. So you can identify the organ. One is skin, the other one is your muscle. Okay, they are going to fight for the blood supply. Fine. So we saw that the cardiac output redistribution, we are compromising the blood flow to the liver, to the kidneys, to the splanchnic circulation, and you also compromise the blood flow to the skin. Okay, when you work out for a short duration activity, when the climate is ambient, okay, the ambient temperature is very optimal, so the skin blood flow is also compromised. Okay, the cutaneous blood supply is also compromised. But when you are working, imagine you are working in a hot climate in a prolonged duration. Okay, so what will happen when you work out in a hot climate? What mechanism will be initiated? Sweating mechanism will be initiated. Yes. So when you sweat, what happens? There is loss of water. So of course your blood volume is going to compromise, or blood volume is going to reduce. Then followed by that, your stroke volume is also going to reduce. If your stroke volume reduces, cardiac output will also reduce. Can you afford to reduce your cardiac output? Is it possible? Can you reduce your cardiac output? You are in the imagine just you are in the 2/3 of your race. Somehow you want to touch the finish line. Okay, can you compromise your cardiac output? No. Okay, so for the reduction in the stroke volume, it is compensated by your increase in the heart rate. Okay, this phenomena is called as cardiovascular drift, which is observed in any prolonged activity. You can see this phenomena. So you can appreciate from this graph. Okay, please take time to appreciate this. You can see the cardiac output is maintained. Okay, you can appreciate that the cardiac output is maintained, and there is a drop in your stroke volume, but the heart rate is increasing. The heart rate is the compensatory mechanism to increase or to maintain the cardiac output. So this happens in a hot climate, which is associated with increase in the body temperature and dehydration. When the core temperature is increasing, this phenomena happens. So what is the exciting factor here, or what fascinates me here is, why can't we increase the heart rate? So is it troublesome? Yes, it is troublesome. because whenever the heart rate is increasing, it will indirectly increase your rating of perceived exertion. You feel that you are exerting yourself to the maximum. So there is a chance that the person may discontinue the race. Okay. So the take home message is the optimal functioning of the cardiovascular system is better to involve increase in the stroke volume rather than to increase in the heart rate. Whenever the heart rate is increasing, definitely it will increase your rating of perceived exertion. You will feel that you are exerting yourself. Okay, somehow I want to stop this. So that will be the feeling you get. So it is going to increase your rate of perceived exertion. So this phenomena is called as cardiovascular drift, which is observed in a hot climate and when you do a prolonged activity. Changes in the blood pressure. So when you do a acute exercise, the blood pressure, of course, the systolic blood pressure is going to increase in proportion to the intensity of exercise you're doing. So it is increasing because your cardiac output is increasing, and the diastolic blood pressure may not show some significant changes, or sometimes it can even decrease. So let us look at the phenomena of increase in the blood pressure. So first, let us take the diastolic blood pressure. So the diastolic blood pressure is decided by the peripheral resistance. We all know that. So there is a balance between this vasoconstriction, which is happening in other regions of the body, and vasodilatation happening in the active musculature. Okay. So when the vasodilatation, the muscles is more. So imagine you're doing a very severe form of workout, you're doing a maximal workout. So there will be an extensive vasodilatation in the muscle. So this is going to shift it towards the vasodilatation side. So there is going to be a drop in the peripheral resistance. So your diastolic blood pressure is going to reduce. So suppose you are doing a moderate activity, a moderate intensity activity. So these are going to be balanced. The vasoconstriction happening in other areas and the vasodilatation happening in the muscle. So therefore, there is no change in the diastolic blood pressure. Okay. So the take home message I wanted to give you here is, suppose if a person is undergoing exercise testing, this is one of the alarming factor. If you see an increase in the diastolic blood pressure, so definitely that's an indication to discontinue the test. So if the diastolic blood pressure is increasing by more than 15 mm of Hg, so it is an indication to discontinue the test. It's an alarming factor. So diastolic blood pressure is not supposed to increase. Either it will be the same, or it will be decreasing. So based on the grade of exercise, as I mentioned, the systolic blood pressure is going to increase proportionate to the intensity of exercise we are doing because of the increase in cardiac output. Diastolic blood pressure in mild activities, it's not going to show any change, and moderate activity, depending upon the extent we are doing, depending upon the intensity we are doing, either it will show a change or there will not be any change. In severe exercise, it is going to decrease because there is extensive vasodilatation happening in the muscle. So now let us look at the blood pressure response in the arm versus leg workout. Okay, so we all do both the activities. Yes, so some days we do an arm activity, when some days we do leg exercise. So which is going to increase the blood pressure? So here we can observe that the arm activity, so the upper limb activity is going to show a much more increase in the blood pressure compared to the lower limb activity. Why there is a increase in the blood pressure in the upper limb workout? Because you can just imagine, when you use your upper limb for any exercise, you have to balance your lower limb, yes or no? For that also, some amount of energy expenditure is happening. And when you exercise, when you use your upper limb, only small extent of muscles are stimulated or working. So therefore, the vasodilatation happening is also less. So just imagine a full body workout or a lower body workout. So the muscles involved are big. Okay, so there is going to be much more vasodilatation happening. So when you do a upper limb activity, there is going to be an increase in the peripheral resistance, and therefore your blood pressure is going to be on the higher side. And moreover, all these upper limb workouts will have a static component. Okay, there will be a static component involved. So just imagine, you are just lifting some weight. You are going to hold it for some time. There is increase in the intramuscular tension, which is going to compress all your blood vessels. So that has to withstand that. Therefore, the blood pressure is going to increase in the vessels. So that is the reason the upper limb workouts are known for increasing the blood pressure to a higher extent, and that is called as a pressor response. Okay, and it has an important implication in the exercise prescription. So when a person is prescribed exercise, so it is more important to target on the full body workout or a lower body workout rather than to restrict ourselves to the upper limb workout. and also it has to be done with caution in individuals who are at risk for any cardiovascular events. Next, moving on to the next important factor, that's a rate pressure product. Many of you will not know what is this rate pressure product. So this variable is an indicator of myocardial oxygen demand. How is your myocardium straining during exercise? So that is this variable about. So it is also called as double product. It is a product of your heart rate and systolic blood pressure. So this rate pressure product is a simple indicator which can tell you how is your myocardium straining. It's an indirect index of your myocardial oxygen demand. So just a simple way of calculating it. So if your heart rate is around 50 and your systolic blood pressure is 120, so the number will be 6,000. Okay. So suppose you do a maximal activity, your heart rate has increased to 200 and your systolic BP is also 200. So what is the number? It is about 40,000. So by this we can estimate so whether there is great myocardial oxygen demand. Okay, so based on this variable you can estimate it. So what is the significance of this rate pressure product? It is a yardstick to evaluate various interventions we are doing on the patients. Okay, suppose if a post myocardial infarction patient is prescribed exercise, if you want to estimate whether there is a myocardial strain, we can use this simple parameter to address whether there is an increased myocardial oxygen demand. And also we can understand that the aerobic training lowers this rate pressure product to a great extent than the resistant training. So next in line is the arteriovenous oxygen difference. So at rest we know that around 20 ml of ml per deciliter of oxygen is available in the arterial side, and of course around 15 ml is there in the venous side. Only 5 is taken by the tissues. Okay, so but during exercise, as you observe in this graph, it is increasing. The arteriovenous oxygen difference is increasing. So you can see up to 15. You can see here up to 15 it is taken up by the muscles. Okay, so there is a great increase in the arteriovenous oxygen difference during exercise. And changes in the plasma volume. So during exercise, because of increase in blood pressure, there is an increase in the hydrostatic pressure in the capillaries. So there is a leaking of plasma into the interstitial space. So of course there is a hemoconcentration. So therefore this is going to increase the oxygen carrying capacity of the blood. So that is an acute change in the plasma. So it has been observed that to an extent of around 10 to 12% of plasma leak into the capillaries are estimated after a prolonged workout. So to summarize what we have seen for an acute exercise, so these are the changes happening when we do exercise. Predominantly it is about the cardiac output redistribution, cardiac output increase, and also about the increase in the skeletal muscle blood flow. Now moving on to the, so before moving on to the next section, so I just want to know from you, will you be able to answer this? Of course, a very simple question I have asked. So tell me, during exercise, the blood will be shunted away from the muscle to the liver and kidneys. True or false? False. Okay, so just to wake you up. Okay, so it is, of course, the other way around. From the liver and kidney, it is diverted to the working muscles. Okay. Now tell me, the rate pressure product is an index of myocardial oxygen demand. Okay, so the myocardial oxygen demand is indicated by the rate pressure product, which is calculated by the product of heart rate and the systolic blood pressure. Okay, so let's move on to the other form of exercise, static exercise. Just take this example shown in the picture. So it's a hand grip exercise. Okay, using a hand grip dynamometer, you can do this simple experiment. Okay, so you can calculate the intensity of this hand grip dynamometer activity in the form of maximal voluntary contraction. We said that we understood that in the previous slides, that using heart rate or VO2 max, we can estimate the intensity of aerobic activity. But when you want to check how much intensity you are doing with the static exercise, we can use the maximum voluntary contraction. Okay, so that is a variable which is used to categorize the intensity of static exercise. So I have shown graphs when you do 10% of MVC, 20 and 50. So of course 50 is a severe one, 20 is a moderate one, and 10 is a mild activity. So you can observe here the increase, there is an increase in the heart rate. You can see in all the intensity of activity, there is an increase in the heart rate. You can see this is a rest period, and this is the exercise period, and this is recovery. Okay. And this is reflected in the cardiac output as well. You can see there is an increase in the cardiac output in all the 3 gradings of exercise. Okay. So the heart rate is increasing with the static exercise. What happens to the stroke volume? So that is the interesting fact here. The stroke volume, in fact, decreases. You can observe the curve here. When the person is doing this hand grip exercise, the stroke volume is decreasing. Can you guess why it is decreasing? Why there is a decrease in the stroke volume? Because just imagine, no, when you just do the same, hold the same position, there is an increase in the tension inside the muscle. Okay, the muscles are contracting. The tension is increasing enormously. So that is going to compress your blood vessels. Yes or no? So thereby it is going to decrease your venous return. Okay, maybe it is minimal. And there will be a reflection in the stroke volume. So stroke volume will reduce when you do a static exercise. The only way to increase the cardiac output will be through increase in the heart rate rather than to the stroke volume. Okay, so this is about a static exercise. And one crucial point we have to remember here with static exercise is marked increase in the systolic blood pressure and the diastolic blood pressure. So I told you why the blood pressure should increase. The muscles are contracting. It is going to compress the vessel, but the vessel has to send the blood flow. Yes, the vessel has to be viable. So how the vessels can increase the viability or distensibility? By increasing the blood pressure. Okay, the vessels are made patent because of the increase in the blood pressure, so the blood flow is continuing. So therefore there is an enormous increase in the systolic and the diastolic blood pressure with the static exercise, as you witness in this graph. You can see there is an increase in the mean arterial pressure. As soon as the person goes for recovery, the pressure is dropping. Okay, so that is about static exercise. So the first half of the session is over. So we dealt with the changes in the cardiovascular system with the acute exercise. Now we are moving on to the adaptation. Whatever we observed so far, there is a lot of change in the physiological functioning of the body when we do acute exercise. Okay, we are doing it for the first time, right? So, but when the body understands that this person is going to torture me every day, okay, he is going to do workout every day. So the body thinks that let me strengthen all my systems to combat whatever this fellow is doing. Okay, so most of the training adaptations will be anatomical change. You can see a lot of structural change happening in the adaptations. Okay, so let us see what happens during adaptation to the training. So there are two forms of training which we commonly come across. One is endurance training, the other one is resistance training, as you see in this picture. So when you do a long duration or maybe minimum of 30 to 45 minutes of activity, okay, when you involve yourself regularly, so that becomes an endurance training, at least 5 times a week. Okay, so minimum of 30 to 45 minutes. If you work out, that becomes an endurance training. Okay, and when you use the strength workouts, okay, when you do workouts to increase your strength of the muscle, that becomes a resistance training. So you can use your body in the form of calisthenics, or you can use the weights available, weight training. So these are the two modes of training we can do. So what is the effect of these two training on the cardiovascular system? We are going to understand now. So first, let me take the endurance training. So because most of the activity we do on a regular basis is endurance, yes or no? Okay, so we are running on the treadmill, we are walking, swimming, all this are endurance. So first, let us look at the changes with the endurance activity. So first in line is the heart size, okay, the dimensions of the heart. So there is going to be a hypertrophy in the heart, but here it is called as eccentric hypertrophy. Okay, it is called as the eccentric hypertrophy. There is an increase in the dimension of the ventricular cavity. You can see here, this picture alone, you can see there is an increase in the dimension of the ventricular cavity, left ventricle. Previously, this was like this. Okay, now it has changed to this. Why there is an increase in the dimension? Because there is chronic improvement in the venous return. Lot of blood is flowing back into your heart, because every day you work out, there is at times the body experiences a lot of venous return coming back to the heart, and this venous return is going to give a constant stretch on the cardiac muscle fiber, and this results in eccentric hypertrophy. And of course, there is minimal thickening of the walls also happening, so that's called as concentric hypertrophy. So how it happens? Okay, so the body responds by adding new sarcomeres in series. Okay, so if one fiber is there, so next to that one fiber is added, so that the diameter of the ventricular muscle, ventricular wall, ventricular chamber is going to increase. So as you see here, whenever the person does endurance training, it's going to be a volume overload, because more blood flow is returning to the heart. Why there is more blood flow? There is increase in venous return, there is increase in plasma volume, there is an increase in red RBC mass. all these are going to reflect on the heart. It is going to be a volume overload on the heart. So therefore, it responds by producing an eccentric hypertrophy. Okay, so as you see in this graph, this is a study which deals with around 1,000 plus athletes, elite athletes who have undergone endurance training. So their left ventricular cavity was measured using echocardiography. So they have observed that most of them showed an increase in the dimensions of the left ventricular chamber. So to the extent of around 60 to 70 meter, okay, so 70 millimeter, it has increased. So almost 14% of the athletes have shown this response. Okay, so that is the first aspect we are dealing with, the increase in the dimension of the left ventricular chamber. The next is the stroke volume changes with endurance training. What happens to the stroke volume? It is increased at rest. When you do a submaximal activity also it is increased, and during maximal workout also it is increasing. So you can see in this graph. So this particular individual, pre-training, this is the graph, and post-training you can see the stroke volume has increased at the submaximal levels, okay? And at the maximal level also it has increased. So why there is an increase in the stroke volume? Because there is increase in the plasma volume. That is an adaptation to endurance training. Okay, and there is greater diastolic filling. Why there is greater diastolic filling? What is the most prominent feature of cardiovascular adaptation in a endurance trained individual? What is the most important factor which happens? I will discuss in the next slide. That is reduction in the resting heart rate. We call it as resting bradycardia. Okay, so there is going to be a resting bradycardia in all endurance trained individuals. If you just measure the heart rate of athletes, it will be in the range of 50, or it can be even sometimes 40. Okay, you may be amazed to see such values. Okay, so there is a reduction in the resting heart rate. So therefore, you can see there is more time for filling during diastole. So therefore, even resting state, the stroke volume is increased. Okay. And also there is more cardiac hypertrophy and Frank-Starling mechanism, which will increase the myocardial contractility. And of course, there is a reduction in the vascular resistance of the afterload. All these factors put together will cause an increase in the stroke volume. So as you witness in this table, so the stroke volume of an untrained individual at rest, it is 50 to 70, and maximum stroke volume, this is the value. And you can see in highly trained individual, it has increased so to a greater extent. So even at rest and during a maximal activity, it has increased. Okay, so this is again a study which shows changes in the stroke volume with endurance training. So this is done after close to 50 weeks of training. It's a long period of training. They have witnessed the changes. You can see the college students who have been taken for the study, and they underwent the training, and you can check the changes in the stroke volume. So this yellow line is the resting value. Before training, what is the level? And after training, you can see there is an enormous increase in the stroke volume. And if you could compare that with the elite athlete, so you can see that the gap is much more bigger. Okay, so the athlete has an advantage of much more increase in the stroke volume. So moving on to the heart rate. Okay, the heart rate at rest will be decreased. Okay, so that's called as the resting bradycardia. So there will be a decrease in the heart rate of around 1 beat per minute per week of training. Okay, so there will be a reduction in the heart rate. So you can ask me a question, will this effect will be there forever? No. So if you discontinue training, so if there is a gap of training for more than 6 weeks, it will be back to normal. Okay, so all the adaptations will be back to normal. So this is because of increase in vagal tone and reduction in the sympathetic activity to the heart. And submaximal heart rate also, there will be less heart rate response at submaximal workouts. Okay, if you compare an individual who is well trained and who is sedentary, therefore the heart rate response at submaximal workout will be less for a well trained individual, and it will be more for a sedentary population. Okay, and looking at this is the most important factor I wanted to stress here. There will not be any change in the maximal heart rate with training. So you cannot expect to do drastic wonders in heart rate with training. Okay, the resting level, it is reduced, and submaximal levels also you show a lower response compared to the sedentary individuals, but maximal heart rate cannot be improved with the help of training. Okay, so just to make you appreciate what is the effect of these factors on the cardiac output, you can see at the resting state. Okay, at the resting state, the sedentary individual, of course, has 5 liters per minute, and trained individual also have 5 liters per minute. You can see the change. Okay, you can see in the trained individual, the heart rate is around 50. It's a bradycardia, and the stroke volume has increased. Okay, so this is how the efficiency of the heart is increased. Okay, so with minimal working, it is going to push more amount of blood. Okay, so the heart rate changes with endurance training. The same is against stress here. Yes. Moving on to the next important concept, heart rate recovery. Okay, so heart rate increase during workout. Okay, we should understand that. Why we should worry about recovery? Can you guess why we should worry about recovery? Why recovery is important? Can you tell me some sport where recovery is very important? Just imagine a footballer. Okay, he is going for a shot. Okay, he's running, he's kicking the ball, and again he should be ready for the next. Yes, okay, next bout of activity he should be ready. He cannot take much time to recover back. So that is why heart rate recovery is also an important parameter. So you can see here the individual who has undergone training, you can see the post training effect, there is a rapid recovery happening. Okay, the heart rate recovers back to normal very quickly in a trained individual compared to the other one. So it is also a very effective way of tracking the training adaptations. Okay, just check if the individual has faster recovery, so that means he is responding to your training. So that is the message here. And the recovery is not only based on the activity, it is also affected by the environmental temperature. Sometimes if the match is there in a very hot climate, what happens? The recovery heart rate, maybe the heart rate recovery will be much slower, because there is the involvement of the ambient temperature also here. Okay, so it is influenced by other factors as well. Now, this question always comes, no, whether increased stroke volume results in decreased heart rate, or lower heart rate results in increased stroke volume, whatever it is. So this is going to increase the efficiency of the heart. Yes or no? Less times it is working, and it is going to pump much more amount of blood. Okay, so this is much more mechanical, better efficiency of the heart. Okay, so that is what we get out of endurance training. So all this changes in the heart rate and the stroke volume is going to reflect in the cardiac output as well. You can see there is an increase in the maximal cardiac output. So post training, the same individual, the same set of college students have shown an increase in the cardiac output, maximal cardiac output. And of course, it is much more lower than the elite athletic group. Okay. Okay. So now moving on to the cardiac output changes. In endurance training, it will reduce the submaximal cardiac output. The other aspect also we should look at in the curve. You can see here, compared to the sedentary individual, there is less cardiac output at submaximal workloads. You can appreciate this part of the curve. So why there is less cardiac output at the submaximal workloads? You can see here, this is the formula I introduced you in the beginning. Yes or no? This equation is called as Fick's equation. So based on this, we estimate the oxygen consumption. So the oxygen consumption at any point of time is based on your heart rate as well as your arteriovenous oxygen difference. Okay. Why there is less cardiac output at submaximal workloads? Because the muscles have become more efficient. Okay. It knows how to extract the oxygen from the blood. And therefore there is and also there is decrease in the rate of oxygen consumption, because we are going for a much more efficient workout. Okay, so when we begin with, we don't know how to do. Okay, yes, so we begin when we do it on a regular basis, the body knows how to efficiently handle it. So therefore the rate of oxygen consumption itself is reduced. So therefore for a particular workload, a trained individual will show us less cardiac output at the submaximal workloads. Okay. Now, next point is about oxygen extraction. So how the oxygen extraction is increased, okay, when post training. So there is an increased oxygen extraction because of effective distribution of the cardiac output, and also the muscles are trained now. Okay, they have more capillaries. Okay, there is presence of more mitochondria. All this will help to utilize the aerobic metabolism to a great extent. So that is why there is an increase in the arteriovenous oxygen difference. So usually we saw that at rest it will be 5 ml per deciliter. Yes or no? So when you do exercise, when you do an acute exercise, it has increased to 15. We saw in the previous curve. But post training, it has now increased to 17. So that is almost the maximum. What is given in the arteries, it is almost grabbed by the muscles. Okay. So that is what is the message here. So there is an increase in the skeletal muscle blood flow because, of course, there is an increase in the maximal cardiac output, and more capillaries are formed inside the muscle. This process is called as the angiogenesis, and there is enlargement or dilatation of the already present arterioles present inside the muscle. So arteriogenesis, all this will contribute towards increased muscle blood flow post training. And myocardial blood flow has also increased post-training, post-endurance training. So we can witness there is an increase in the cross-sectional area of the coronary arteries, increase in the capillary density, the most important point, and recruitment of collaterals. So these 2 points indicate the beneficiary effect of exercise prescription for a patient post-myocardial infarction. So those who have suffered from an episode of myocardial infarction, so they are usually started with exercise training after maybe after a few weeks. So this is the benefit we get. There is recruitment of collaterals as well as increased capillary density in the ischemic area. So that is the benefit we get out of endurance training in a population who has suffered from a myocardial infarction. Next, moving on to the blood pressure changes. Many at times we have this question: when we do exercise, will the resting blood pressure reduce? So many patients with hypertension will ask this question. So if I do this exercise, if I do walking, will my BP reduce? Yes, it will reduce, but actually it is of lesser extent, to the extent of around 6 to 7 mm of Hg. There is a reduction in the systolic and the diastolic blood pressure in the hypertensive individuals. Why it is reducing? There is a concept called as post-exercise hypotension. Okay, during exercise the blood pressure increases, yes or no? But post-exercise, there is a reduction in the blood pressure because of decrease in the sympathetic drive, and based on the other factors, there is extensive hypotension happening. So cumulatively, all this post-exercise hypotension is contributing to the reduction in the blood pressure. So that is why we witness there is a reduction in the blood pressure when the person does regular endurance training. Okay, so this is again a position statement from American College of Sports Medicine. What is suggested here is, when a person is involved in regular aerobic exercise, there is a reduction of blood pressure of 5 to 7 millimeters of mercury. So and also it reduces the risk of any cardiovascular events. Okay, and even incorporating resistance exercise in the work regimen, so that can also serve the purpose. Now moving on to the changes in the blood volume post training. So one point I wanted to highlight here is there is an increase in the plasma volume. Why there is an increase in the plasma volume? There is retention, more production of plasma proteins like albumin. So there is expansion of the plasma volume. At the same time, there is an increase in the RBC count also. Okay, when a person is doing endurance training, maybe after 6 weeks we can expect this change. The RBC count is also going to increase. Both are trying to account for the increase in the blood volume here. But you can see here, even though there is an increase in the red cell mass, the hematocrit is remaining the same, or it is actually decreasing. Why it is decreasing? Because there is an increase in the plasma volume. Basically, there is dilution happening here. So that is what is the change when the person does endurance training. Okay. So let me introduce one term here that's called as sports anemia, also called as pseudo anemia. So that's a misnomer actually. So we say that this person is suffering from this particular athlete is suffering from anemia, but if you check it properly, there will be an increase in the plasma volume. Because of that, there is a reduction in the hematocrit. Okay, so that is a relative value. So it is not that it is worrisome. Okay, it's a misnomer. So both hemoglobin percentage and the total number of RBCs are going to increase post-training, and the plasma volume is also going to increase. But the increase in the plasma volume is more compared to the increase in the RBC count. So that is the reason there is this condition called as pseudoanemia or sports anemia. Okay, so now let me summarize this effect of aerobic training on the cardiovascular system. So you can witness from this table. The cardiac output, you can see there is enormous increase in the trained athlete to the level of around 30 liters per minute, and the stroke volume has also increased, and the heart rate, maximal heart rate is almost the same. You can see there is no change in the maximal heart rate. The only parameter which is not showing any response to the training is your maximal heart rate. Okay, so this is the summary of the changes happening during adaptation. So there is an increase in the plasma volume, red cell mass, which is going to increase your total blood volume. And this in turn is going to increase the venous return. The chronic increase in the venous return is going to stretch the ventricular muscle fiber. And therefore, this is going to reflect in volume overload of the heart. This is going to reflect in eccentric hypertrophy of the heart. And all this will will increase the end diastolic volume and also increase the myocardial contractility. So maximum stroke volume and the cardiac output is going to increase. So this cardiac output is effectively distributed to the working muscles, and there is also increased usage of this blood supply by the muscle. Okay, the muscle have also become smart here, so they have increased their capillaries, they have increased their mitochondria. So the aerobic metabolism is going to much more be prominent here after adaptation. Okay, so this is about endurance training. So just few slides about resistance training. With respect to resistance training, the adaptations are more in terms of the muscle and the neuromuscular connectivity, rather than in the terms of cardiovascular adaptations. So more adaptations are there in the muscle. So now let us target the cardiovascular adaptations alone. So the cardiac dimensions, we saw that there was an increase in the diameter of the left ventricles with endurance training, but here there is an increase in the thickness of the ventricular wall, as you see in this image. So there is an increase in the thickness of the wall, and this is called as concentric hypertrophy. Why there is increase in the thickness of the wall? Constantly the heart is exposed to a higher workload. It is exposed to a higher afterload, because whenever the person is doing resistance training, what is happening? There is going to be an increase in the blood pressure. Okay, there is enormous increase in the blood pressure. So when the heart is exposed to a increased blood pressure for a very long time, it is responding in terms of a hypertrophy, so that it is able to combat that high pressures prevailing in the blood vessel. So this results in concentric hypertrophy, and this is called as the pressure overload of the heart. And this the response is by adding new sarcomeres in parallel. Okay, so that is going to increase the thickness of the ventricular muscle wall rather than the diameter of the cavity. You can see the dimensions of the cavity remains the same, but the thickness alone increases. So this is called as concentric hypertrophy. Okay, so this is why it happens, because to combat wall stress. What is this wall stress? Any hollow viscera, it is exposed to this wall stress when it is calculated by the distending pressure times the radius by wall thickness. Okay, so when we talk in terms of the heart, okay, so the left ventricular pressure is going to be more because it has to work against the afterload. So when it is exposed to the constant higher pressures, it has to the wall stress increases. Okay, how to reduce this wall stress? It is by increasing the wall thickness. Okay, so when you increase the wall thickness, so the wall stress is going to come down. So this is the way of tackling the problem by the heart. So this results in the concentric hypertrophy of the heart. Okay, this leads to the remodeling of the cardiac muscle fiber. And this is the reason, this is because of this concentric hypertrophy, the resistance trainings resistant workouts are prescribed with caution, particularly those individuals who are prone for a cardiovascular event. Now, lastly, about the blood pressure response, as I mentioned, there is an increase in the blood pressure, so which we call it as a pressor response. So that is the reason, and also we have to understand that at rest, if this individuals, if you take a bodybuilder or if you take a weightlifter, so can we just guess whether he will have a higher resting blood pressure, whether his BP will be more at rest? No, it is actually a misconception. Even when he does a regular resistance training, the resting level of BP do not elevate to a much higher level. And even we can suggest resistant training as a part of the exercise program for everyone, but this should not be the only sole modality of exercise prescription for individuals. We have to combine with the endurance workout. So lastly, to summarize, we have come to the end of the presentation. So what are the changes happening with the acute aerobic exercise? We have witnessed that there is an increase in the heart rate, stroke volume, cardiac output, systolic blood pressure. There may or may not be a change in the diastolic blood pressure. And we have to know about the cardiac output redistribution, the diversion of the blood flow to the working muscles. And static exercise, there is an increase in the heart rate. And in fact, there is a reduction in the stroke volume. And we are seeing a pressor response as a blood pressure response. And with endurance training, we saw that there is resting bradycardia and decrease in the submaximal heart rate. No change in the maximal heart rate. The point to be very much stressed. And we cannot change the maximum heart rate with training. And there is going to be an increase in the stroke volume at rest during submaximal workload and maximal exercise. Increase in maximal cardiac output, increase in oxygen extraction by the tissues, plasma volume, and the red cell mass is also going to increase post-training. And with regard to the resistance training, we are witnessing a concentric hypertrophy of the heart, and reduction in the resting heart rate is also possible with the resting heart rate, but not to that extent as that of a trained endurance trained individual. and reduction in the resting blood pressure is also witnessed here. This is pretty much the picture of what we have covered in this particular session. So hope you would have understood the concepts. New concepts have been introduced to you. If you do further reading about this, maybe you can have much more better idea about the cardiovascular changes during exercise. And this is very vital for exercise prescription, also for improving the optimal health of everyone. Okay, not only for the athletes, for optimal health of everyone, we should have a basic understanding of the cardiovascular responses to exercise. Lastly, can you just recollect eccentric hypertrophy occurs in endurance training? Excellent. Thank you.
Thank you, Dr. Vasanthi ma'am, for that insightful and enlightening session. Your deep dive into cardiovascular dynamics during exercise has truly enhanced our understanding of how the cardiovascular system adapts to physical activity. From discussing heart rate regulation and blood flow redistribution to intricate mechanism behind our oxygen delivery, this session has truly expanded our knowledge of exercise physiology. Now I would like to call upon Dr. Padmavati ma'am, Dr. Muthu Pratibha ma'am, and Dr. Priscilla Johnson ma'am to felicitate Dr. Vasanthi ma'am. Now I would like to call upon Dr. Abhirami ma'am to deliver the vote of thanks. Following which we would have where there would be an activity for the offline participants.
The online activity will be called off. We will close the online meeting after the session. Whereas I request our students to remain because Dr. Divya has planned an exciting offline activity for you after the session. Okay. Over to Abhi ma'am for the vote of thanks.
Good afternoon. It's my pleasure and privilege to propose a vote of thanks for this academic event. On behalf of Department of Physiology, we thank our university management officials, Chancellor, Pro-Chancellor, Vice-Chancellor and Pro-Vice Chancellor, providing the state-of-art infrastructure and uninterrupted support for all our academic activities. We extend our sincere thanks to Dr. K. Balaji Singh Sir, the Dean Medical College, for being the pillar of support in all our academic activities. We express our sincere gratitude to our guest speaker, Dr. C. Vasanthi, for taking her time off to share her knowledge and expertise in the core area of physiology, that is cardiovascular dynamics during exercise. It is our pleasure to extend a heartfelt gratitude to our HOD, young and energetic HOD, Dr. K. Muthu Pratibha, for hosting such guest lectures, which helps to stimulate higher order learning among undergraduate and postgraduate medical and paramedical students. We also thank her for helping us in meticulously planning each and every step of this event and successfully executing it. I would like to thank our senior professors, Dr. R. Padmavati and Dr. Priscilla Johnson, for encouraging and guiding us during all our academic endeavors. Our special thanks goes to PALS 2 team. This is the second lecture of our Physiology Alumni Lecture Series. For that, I would like to thank the coordinator, Dr. Divya Lakshmi, Assistant Professor of Physiology, for taking sincere efforts in planning and coordinating this event. I'm also thankful to second year MD postgraduates of our department, Dr. Pavitra, for preparing the invitation and disseminating the information to all the students, Dr. Vivek for the audiovisual arrangements, and Dr. Lavanya for anchoring this event. I extend my sincere gratitude to other members of our department, other faculty, technicians, secretary, and other support staff for their sincere and untiring effort to make this program a grand success. Last but not the least, we thank the participant, undergraduate medical and paramedical students, postgraduates who have joined both online and offline. Hope this session was very educative and enlightening in the core concepts in exercise physiology. We'd also like to thank our communication and audiovisual team of our university for the continuous support to conduct this program in hybrid mode. Thank you all once again for your patience listening. Thank you.
As we come to the close of this insightful session, I would sincerely thank Dr. Vasanthi ma'am for her time, expertise, and invaluable contributions to today's discussion on cardiovascular dynamics during exercise. And I would like to thank Dr. Muthupratipa ma'am, head of Department of Physiology, for giving me this wonderful opportunity to host PALS 2. And I'm very grateful for your trust, constant support, and encouragement. Thank you. And a big thanks to the Department of Physiology for organizing this initiative, and to all the participants and for your enthusiasm and the engagement. Your presence and interactions make PALS a vibrant platform for learning and knowledge sharing. Before we wrap up, a quick reminder: e-certificates will be provided to all the registered participants who fill the post-test and feedback forms. For the online participants, the link for post-test and feedback forms would be shared in the Zoho group chat. And for all the MBBS students should scan the QR code for the post-test form, which is displayed in the screen.
Now, post-test is...
There are not posted. No, MBBS ki just display பண்ணுங்க. Please mute the audio and video of the online meeting first. Yeah, and now I will put